So, state exam, feeding a resident. Okay? Feeding a resident. So, number 1, hand hygiene. Number 2, Mrs. Johnson, I'm going to feed you, okay? Gonna give you some food here. You ready for a breakfast? Good job. Awesome. I'm gonna help you. Number 3, ask resident to state name and verify name match the name on the diet card. Okay? So, wap mande patient pou citer non li. Alright? Ap toujou gen yon ti carte sou tray sou tabla à côté plat qui gen non patient là-dedans pour identifier que c'est pour li. OK? Et la gen qui qualité manger qui dans plat. Alright? So, the diet card is going to be on the tray, okay? And it's going to have the patient name and type of diet that this patient is on. So you have to ask the patient for his or her name. Can you tell me your name? Okay? And then you verify to make sure patient name matches, okay? So for checker si non patient matche diet card là. All right? Number 4. Position the resident upright. Head of the bed up. Monte tête cabane, no? Okay? Number 5. Protect clothing from soiling using napkin, clothing protector or towel. C'est-à-dire, m'al mette yon serviette autour de poitrine patient. Alright? Number 6. Provide hand hygiene for the resident. Okay? So on the state exam, they could have wet wipes for you to clean the patient's hands. Dans examen l'état, y a gen wet wipe pour capable nettoyer mes patients. Okay? Now, in the nursing home or the hospital, if you don't have wet wipes, you can use a towel, right? Go wet the towel with soap and water and come and wash the patient's hands. Okay? All right? So, dans l'hôpital ou bien dans un nursing home, ou ka prend une serviette, ou alors mouiller un point avec de l'eau et savon, et pour venir laver mes patients ou sécher avant ou même ou commencer à manger. Okay? Even though the patient is not the one feeding themselves, but hands needs to be clean as you eat. Même lorsque c'est pas patient qui baille tête li manger, but formel propre, li pral manger. Number 7, ensure residents' hands are dry before feeding. Okay? Sécher mes patients avant de manger. Number 8, place soiled linen in designated laundry hamper. Si c'est serviette ou t'es utilisé, mettez-le dans laundry hamper. Yeah? Number 9, sit in the chair facing the resident while feeding the resident. Okay, wap chita en face patient pour bal manger. All right? Number 10, describe the food. Okay? So on your state exam, you can have yogurt for food, applesauce for food, water and juice. Okay? Water and juice. Okay? Now, number 10, describe the food. So I tell my patient. Number 11, offer fluid frequently. Okay? Offrir un petit bagay pour le boire de temps en temps. Offer small amount of food at a reasonable rate. Pas plein cuillère à trop. Mettez la moitié. Okay? Don't fill up the spoon. Do it halfway. Just half spoon. Okay? Slowly. And give up the patient time to swallow, to chew and swallow. Half spoon food, full, a little bit of drink. I'll be with you in a little bit. In a little bit. Please. All right. Sorry, mama. All right. A half spoon, moitié cuillère, ou ballon de temps pour le manger, pour mastiquer et avaler, on tire liquide. Okay? So now, allow resident time to chew and swallow. Prends son ba moun nan temps pour mastiquer et avaler. Okay? Both on the state exam and in actual life. ni nan examen l'État, ni nan lor gen vre patient devan. Because your patient could choke on the food. You need to take your time and go slow. Patient ka choke, ka manja ka koke nan gagan, ni fò pran san. Okay? All right. So, number 14, wipe the resident's hands and mouth after feeding the resident. So, ou fin bal manje, ni nan juice, ni nan yogurt, ni nan applesauce, ni nan juice, ni nan gloa, lèl fin manje, ou suye meni. Okay? All right. Number 14, wipe hands and mouth. Okay? 15, remove clothing protector with Sirisa. Okay? And place in laundry hamper. All right? Number 16, leave the resident sitting upright in bed with the head of the bed up to at least 45 degrees. Kite tèt kaban nan monte. Okay? Apwa fin bay pasyon manje. Number 17, record intake as a percentage, okay? So 17, 18, 19, and 20 is documentation. Now, let's talk about documentation. And nous parler de documentation. Your attention, please, because this is where most people fall, okay? So, dans documentation, on va bien document ça pour documenter là-dedans. Okay? Patient you have to document total fluid intake. For documenter liquide que patient boit. Juice and water, right? So, on the body of the cup, it says the total amount that the cup can hold. Nan cup la la di ki quantité cup la ka kembe. So, par exemple, cup sa, juice la, okay? So, for example, the juice was 240, the water was 240 ml. Okay? Patient get 2 cups. Look how much is left. Gade equivalent patient ki rete. If patient drink all of this, we say glass 1, 240, right? Si patient boit tout jus, right? Glass 1, 240 ml. If patient drink all the juice, all the water, 240. So 240 plus 240, patient drink everything. What's the total? Ki total la? 480. Right? But if patient drink half, si patient boit moitié la, okay? Glass 1 is how? Is how much? If patient drink half. Okay, so half would be 120. So glass 1, 120. If patient drink another half here, si patient boit moitié nan sa, okay, so how much is that again? 120. So glass 2, 120. 120 plus 120 is how much? 240. 240. Does that make sense? Tu comprends me? Very good. If patient drinks, say, a half of the juice, how much is that? 120. But if the patient did not drink the water, okay, that's 0. If patient refuse, you can put refuse, or 0. So what's the total? Ki total la? 120. So you have to look at the glass. For gade, deux gode yo pou ki quantité te la dan lè la komanse, ki quantité krete. How much patient drank and how much is left over. Okay? So fluid you document in ml, ou documente ça en ml. Liquid, food, okay? Now I have yogurt, I have applesauce, okay? when I document the food, I have to document in percentage. Les m'a documenté manger, faut me documenter en pourcentage. N'est-ce pas? So, as I document in percentage, here's what's going to happen. So, I see how much it was when it was full. Moi qui quantité était plein. Et m'a regardé pour moi qui quantité crété. Okay? So, you can look to see how much was left. M'a regardé moi? So, if my patient ate this much here. Okay? Now, first of all, on dit ça bien. Si patient mange tout. If patient ate everything here and everything here. Okay? What's the total percentage? 100%. Patient ate everything here and everything there. Si patient mange tout, c'est qui ça? 100%. Okay? If the patient eats half of this, and patient eats half of this, how much did my patient eat? 50%. Vous comprenez? You getting this?
Yeah.
So that would be total 50%. Okay? If patient eat half of the yogurt and all of the applesauce.
150.
Si patient mange moitié dans yogurt là, et puis il mange toute applesauce là. Very good. If patient ate half of this, so this is half, and this is a quarter. Ça c'est moitié total là, ça c'est un quart de total là. So you're right. Patient ate how much? Combien? 75. Make sense? So if everything is there, okay, and patient only eats this much, and all of it is left. Patient says, I'm not hungry. How much did my patient eat? 25. Okay, very good. So it's either going to be 25, 50, 75%, or 100%. Okay? If patient says, you know what, I don't want to eat today, leave me alone. How much did your patient eat?
0.
0%. Very good. Make sense? If patient only eat the yogurt, says, I don't want the applesauce, how much did the patient eat? 50%. Okay? Make sense?
Yes.
Very good. So, in your documentation, very good. In your documentation, you have fluid and put in ml. On documenter liquide là en ml. And you have food in percentage. On documenter manger en pourcentage. Okay? All right. Thank you.